Today's video contains an amalgam procedure class 1. This is the amalgam tray. This is a procedure done because it's stronger than composite but does not look as good for aesthetic. This is why it is only done on a posterior tooth. First, we check the patient's chart to ensure we are working on the correct tooth, and we visually check with the basic theory. Then we anesthetize first with topical, then with local anesthetic. Once the patient is numb, the doctor is called over to prep the tooth. We then rinse and dry and then begin the long process of forming retention. Retention is formed so that the restoration does not fall out. We then apply di-cal to the floor, but not the walls of the prep. Then we apply copalite to both the floor and walls of the prep. This is to keep the amalgam from staining the tooth. Now we mix the amalgam. We place the now mixed amalgam into an amalgam well, and from that well use it to fill an amalgam carrier. We then place the amalgam in the prepped tooth and use a condenser to make sure there are no air voids. We then use carvers to carve anatomy into the amalgam. After that, we use burnishers to smooth out all of our carved lines. We then wipe with a damp cotton roll and spray with air. This is to ensure there's no excess amalgam. Lastly, we check the bite with articulating paper.